guys, here to give you guys a video demonstration on vital signs. So you guys had a demo in lab this week. You have a whole lab practicing this next week, and then we're gonna go into OSCEs. So I just wanted to give you a video that you could refer to. So here is the marking guide that's posted in Blackboard. I want you guys to print this and use it. Take it to drop-in labs, use it when you're practicing on friends and family. This is gonna be your guide and your how-to. All right, so first thing I wanna do is start with hand hygiene. So I'm gonna wash my hands and I'm gonna make sure that I have all the supplies that I need in order to obtain a set of vital signs. So some of the supplies that I need is a watch with a second hand, I need a blood pressure cuff, I need a stethoscope, and I need a thermometer. All right, so we're gonna start with a temperature. I'm gonna go in and introduce myself. So hi Mariah, my name's Connie. I'm gonna be your nurse today and I'm here to get a set of vital signs. So that's gonna include your temperature, respirations, pulse, and blood pressure. Is that okay? Yes. All right. So first thing I'm gonna do is start with a temperature. So when I remove the probe from the machine, it's going to turn on. The little blinking head is gonna be for an oral temperature, which is what I'm going for, and I'm gonna push the button to make sure that I'm in the correct mode for degrees Celsius. I'm gonna place a probe cover on. Can I get you to place this under your tongue and close your lips around the probe? So I placed the probe in the posterior sublingual pocket. When it starts to spin, that means it's reading, and I'm just gonna wait for it to beep. So 37.3 degrees Celsius. So the normal parameters for a temperature is 36 to 38 degrees Celsius. When I press this button, it's gonna release the probe, cover into the garbage, place this back in and the machine shuts off. The next thing I'm gonna do is I am going to get a pulse reading, all right? So when taking a radial pulse, I wanna take the patient's arm, I wanna be on the thumb side, and I'm gonna use my fingers to palpate and feel for a pulse. Okay, so I'm gonna count this pulse for 30 seconds and times it by 2. I'm gonna tell the patient that I'm doing it for a minute, and the second 30 seconds, I'm actually gonna take their respirations. All right, so I'm gonna count your pulse for 1 minute. All right, so I counted your pulse for the first 30 seconds and I got 34. So I'm gonna multiply that by 2, which gives me 68 beats a minute. So I know that Potter and Perry states a normal pulse is between 60 and 100 beats per minute. That's gonna be the rate. The rhythm was regular, so a nice regular tempo, and the quality was a 2+. So it wasn't bounding, but it wasn't weak and thready. All right, the second 30 seconds, I counted your respirations. Now, I didn't tell you I was gonna do that because it can alter your pattern of breathing. So when I counted for the 30 seconds, I got 8 breaths. So I'm gonna multiply that by 2, which is 16 breaths per minute. The normal breaths per minute is 12 to 20. The rhythm, again, was a nice regular tempo, and the quality, you had nice deep breaths. So you weren't shallow and you weren't gasping, all right? The next thing I'm gonna do is obtain a blood pressure. So I'm gonna do a 2-step blood pressure reading. And when doing a 2-step blood pressure reading, what we're doing is we are obtaining a baseline, okay? So the first thing I wanna do is get my cuff out, make sure it fits my client correctly. So I'm gonna pull the sleeve up. I'm gonna take the end of the bladder and measure it around the arm. So this should be no more than 40% the circumference of the arm. All right, I wanna know which side goes out. So this side goes away from the patient's skin, and there's a nice little artery marker here. So when we're doing blood pressure, we are using the brachial artery. So if you look at the patient's arm, it's gonna be on the pinky side, and it's gonna be just above this antecubital fossa, okay? That's where I want the artery marker to go. So we are going to place it 2 to 3 centimeters above the antecubital fossa with the artery marker lined up at the brachial artery, and I'm gonna secure it nice and snug. I am going to use a pillow to maintain that the arm stays at the level of the heart, okay? And I'm gonna make sure all my stuff isn't tangled here. I wanna make sure that my valve is closed, but not closed so tightly that I can't open it with one hand. And I'm gonna palpate that brachial artery, okay? Something that can help you guys find this is if the patient slightly hyperextends their elbow, you should be able to feel it on that inner side of the antecubital fossa. Now, when you're in your OSCE, if you're palpating for a brachial artery and you just can't find it, that's okay. I want you to try there, but if you can't find it, don't pretend like you can feel it. You can come down here and you can go to a radial pulse and inflate the cuff until you can no longer feel it and go 30 millimeters of mercury higher, okay? So try with the brachial, but if you have to use the radial, that's okay too. So I can feel her brachial artery or her brachial pulse. My valve is closed and I'm gonna start to inflate the cuff until I can no longer feel it. So feeling, I can still feel it. Okay, I can't feel it there. So at 116, I'm gonna go to 146 to make sure it stays obliterated, and it does. I'm gonna bleed the cuff off. So the reason we're doing this is to obtain a baseline. That should be around what her systolic number is. So when we do a two-step blood pressure, we're doing that to rule out an osculatory gap. So an osculatory gap or a silent gap is when there is Korsakoff sounds and then they diminish, or they're absent and then they return. So by ruling out an osculatory gap, we're making sure that we're getting a true systolic reading and that we're not getting an underestimated systolic reading. All right, so we've bled the cuff off. Now I move to the listening part. So I remember that her baseline was 116, so I'm gonna go to 146. I'm gonna put my stethoscope in, place it over that brachial artery, make sure my valve is closed and that nothing is touching my stethoscope. I'm gonna inflate the cuff to 146 and I'm slowly gonna bleed it off. I want it to move at about 2 millimeters of mercury per heartbeat. So we're going to 146. Now I heard the first Korsakoff sound at 118 and I heard the very last one at 72. So the systolic would be 118 and her diastolic would be 72. The normal parameters, according to Potter and Perry, is anything above 120 to 139 systolic and anything between 80 and 89 diastolic. So the diastolic was a little bit low. Mariah is young. She's tiny, but I would want to check her for symptoms. So Mariah, do you ever feel dizzy when you stand up?
No.
Are you feeling dizzy right now?
No.
Have you drank liquids today and had stuff to eat?
Not really.
Not really. So dehydration can sometimes cause a little bit of a lower reading. We just always want to check for symptoms, and then you would want to document your findings because it was below that parameter. You're always going to document, but you would want to document that it was abnormal. All right? Do you have any questions?
I don't.
You don't? All right. Well, thank you very much. All right, guys, so that's your demo for vital signs. What I want you to do is practice. Hit up drop-in lab, utilize that lab time next week, and good luck on your OSCEs.